Good evening. I am Dr. Asutosh Das, physician from district Tamluk, West Bengal. I am telling about the overweight and weight and the acid peptic disorders, which affects mainly the overweight that usually disturbs the acid peptic disorders and precipitated acid peptic disorders is mainly it is the GERD, gastroesophageal reflux disease, and the peptic ulcer. These are the main the body and overweight. It precipitates, and if we can control the overweight, then we can control the acid peptic disorders, as overweight can cause pressure over the intestine, and as a result, it makes the food particles go up from the stomach and causes gastric reflux. So if we can reduces the weight, there is so many ways by which we can reduces the weight. Especially the diet is the main factor, as also diet itself causes the precipitations of gastric ulcer disease and acid peptic disorders, especially those foods which are high calorie with excessive fats, spicy food, and especially the caffeine, coffee, cold drinks, and other drinks, alcohol, and the food particles like high protein foods with spice, like fatty, excessive fat containing meats, and also the fatty products, dairy products. These all can precipitate the peptic ulcer disorders and acid peptic disorders. So we will reduce these products from our food particles, and the special foods, those who are very much effective, these are especially the green leafy vegetables, less spicy foods, and frequent small meal. These are also very important. And also the whole grains, these also improve our acid peptic disorders. And also, if we can reduces our weight, by which we can reduces the disease process, especially how we can reduces our weight. Diet, I have explained. Second is the reductions of the weight by exercise. If we can do regular exercise and especially 30 minutes walk per day and 160 minutes per week, then we can, and it should be regular, then we can reduces our weight. And also swimming is also a good exercise. If we cannot do it, outdoor exercise, indoor jogging, skipping, and also the treadmill walking, that is important. By any means, we will reduces our calories, and the BMI, the body mass index, that is very important. If it is more than 25, that is called overweight, and more than 25, 30 or 35, it is excessive weight. And if we can reduce this weight by all these means, then we can reduce the acid peptic disorder, especially the reflux disease, that can be reduced. And any body whose weight is excessive and overweight, they must take the consultations of the special gastroenterologist or minimum any physicians. And regarding the diet, there is so many dietitians and experts regarding the diet. We can consult with the dietitians, and patient can get maximum benefits from these dietitians. So the help of the dietitian is very much important. And the drugs which are used in acid peptic disorders, especially the proton pump inhibitors and H2 receptor blockers, these drugs efficacy reduces if there is overweight, and overweight also precipitates the disease process. So if we can reduces the weight and reduces all the food particles, then it can reduces the acid peptic disorders, and also the peptic ulcer disease, which is precipitated not only by these food particles, but also drugs is very important. Some drugs, especially the NSAIDs, that are very much important, and the steroids, especially the prednisolone group of drugs. If we consume all these drugs also precipitate the acid peptic disorders. So we must be conscious and cautious about the medicines which we consume or we prescribe the patient for their disease ailments. So we must think about the reductions of weight and special food particles that should be taken. And also sound sleep and good sleep is also very much important for reducing the peptic ulcer disorders. And another important point for GERD, that is the frequent small meal. We must take the food particles 4 to 5 times per day in different times, especially 4 to 6 hours gap. And the night dinner should be taken within 8 to 9 p.m. And if there is required, we must take some foods, especially biscuits or fruits at night, during sleep, and it will help the reductions of the disease process. And also we must take some exercise, especially walking after dinner, and we must take water before the food and also 30 to 50 minutes after the food. It will also reduces the peptic ulcer disease, especially the GERD process. And the sleeping system, which is also very important. We must keep our head to some extent above the ground level, and also use some higher pillow by which we can maintain the head above, and then that is also reduces the GERD, and we can reduces the disease process. So the peptic ulcer disease, especially the GERD and the peptic ulcer, these two diseases are very much important, and almost in India, almost 70 to 80% population suffers from any kind of these two disease. So we must be aware of it, and we must tell a patient to take the specific food particles and regular exercise and sound sleep. That is very important for the patient for maintaining their lifestyle. And also another important factor is very important, that is the anxiety, tension, stress, strain. All these factors are also very important, as because this stress, strain, and anxiety, it increases the acid secretions and GI motility effect. So anxiety, tension should be reduced, and some meditation, yoga is also important for our lifestyle that can improve our mental, physical, and social health, by which we can also reduces the acid peptic disorders. And so it is my earnest request to all the acid peptic disorder patients, be careful regarding your foods, regarding your exercise, and regarding your research. You must maintain your BMI within 25, and also the society and the public, and also we must gadget them with the televisions or newspaper or local YouTubers, that everybody should maintain their lifestyle and maintain their BMI, maintain their weight, and reduces their body weights. And also they must change their lifestyle, reduces their anxiety, tension, depressions by meditations and other elements which can precipitate the peptic ulcer disease, especially the acid peptic disorders. And also we must be very much careful about their lifestyle that can improve the whole society's peptic ulcer disorders, as if everybody takes either H2 blocker or PPI regularly without knowing the consent of the physicians. And also shopkeepers are supplying the H2 blockers and PPI regularly to the patients. That is also harmful for the patient, then, because everybody needs some amount of acids for their digestions and destructions of their pathogens which are engulfed through the oral cavity along with the food particles. So to some extent acid is required. So if we use PPI at a long durations, that may precipitate chronic gastritis, and also ultimately it may develop gastric CA. So uses of PPI and H2 blocker should be reduced, and judicious use of these things by the advice of the physicians or the gastroenterologist is very much important. And if the disease process increases gradually, we must refer the patient for the gastroenterologist or the super specialist for their opinion and their suggestions. So everybody needs the proper actions for the gastroesophageal reflux disease and the acute peptic ulcer and chronic peptic ulcer disease. And that is my advice. You must take proper care and proper advice from your proper doctors or physician regularly for this. Thank you, everybody.